Hey fam, welcome to the Powered by Iron Health podcast. This is Alina with Iron Health and Dr. Joe, the founder of Iron Health. And our mission at Iron Health is to create a community that raises the standard of health and wellness. And our vision is to impact 100,000 lives through our health and wellness services. And we figured one of the best ways to do that is to share our experience, share our insight in the health and wellness field by bringing you a podcast. So however we impact those 100,000 lives is amazing, and that's why we're here today. Before we get started, we're going to be talking today about most common injuries that we see, especially for Joe. He's been doing this for over 10 years, and things have changed in the last 10 years between COVID and a lot of other stuff that's just happened with our society. And so he's going to talk a lot about most common injuries, what they are. We're going to talk about ways to prevent them, specifically one. And we're going to also talk about when to know if you need surgery or not.
Before we dive into that too, just on Alina's point, changing 100,000 lives, we're actually coming out with an ultimate wellness event, September 27th, called IH Rocks. It's inspired by High Rocks. We're going to have a workout for people that participate in. We're going to have PTs there with a table to do some work. We'll have an acupuncturist, massage. We'll have some food. We really want to create an awesome wellness event, an experiential event, because you grow from your community. So we want to make sure we instill a community of wellness. It's going to be in our Briarcliff Manor location, but everyone's invited. We're going to attach the link to sign up below. So I hope to see you there.
Awesome. Thank you. So our biggest injuries that you see, what are the three biggest injuries that you see?
Yeah, so the people who come into my clinic the most are either lower back pain, number one, shoulder injury or shoulder pain, or knee pain. Those are the three big things we see like clockwork.
For today's purposes, we're going to focus on one, and then we'll go into some other ones in the future. You said that lower back pain's the biggest one that you see.
Yeah.
So we'll talk about that today. If you have lower back pain, then keep on listening, or if you know somebody with, or just back pain. I always specify lower back pain because I feel like when I work with people and train people, it's usually where they kind of point to or say that they've had, MRIs that show bulging disc or slip disc there. So with that, why do you think that's the most common back pain?
I mean, it's really an epidemic. How many people are suffering with back pain on a daily basis is astronomical.
Why is that?
I don't know, honestly. There's probably a lot of factors that go into it. I would say, this isn't studied as to why I think it is, and I don't think they really do know why it's the most common, but I would say sitting, our society, lack of activity, overweight. Like there's so many variables that go into lower back pain. Psychosocial, like lower back pain can be very somatic rather, where it's a part of your psyche. But it's the number one thing people come into our office for, or we see people with lower back pain. Now, there's a slew of things it can be, which we can dive into. And I think for educational purposes, we can dive into the things that it can be anatomically for education again. And I don't know if that's where you want to start.
I do, because I think a lot of people, I know a lot of people, and I do this myself too, Dr. Google, now we have ChatGPT.
The chat.
Just like my favorite.
We're starting to trend now.
But I think people will look up their symptoms and be like, my lower back hurts when I walk, or hurts when I'm sitting too long or whatever. And a lot of people will come in and they'll be like, I have sciatica. And they'll just like off the bat say that. I'm sure you get that all the time.
Oh yeah, for sure.
So they just already are diagnosing themselves without even going to without even getting assessed, either at PT or with an ortho, which by the way, you don't always need to go to the ortho to find out. Like a lot of PTs will do an evaluation and give you better insight. And if they don't know, they'll direct you to an ortho. So you can kind of cut out that step sometimes. So what do you think? What do you see?
Yeah, so I think the best way to think about lower back pain, or pain in general, but lower back pain specific, I'll teach you how I think, because that's how I take people through my evaluation and diagnosis to understand what's going on. I think in a framework, right? This is the concept of like, how do I know what's going on in someone's lower back is in a framework.
Is this you specifically, or all PTs do this? Or most PTs?
Most PTs do this. This is how we're trained. PTs are really like, we solve puzzles. Like when you look at someone's body, I have lower back pain, we have to do a diagnostic evaluation to figure out where it's coming from. So it's a puzzle that we're putting together. You have this, this, and this. What's happening? And now most good PTs are very good at orthopedics and neurological, because those are two different things. You need to do a deep dive of a neurological assessment to see if it's really coming from the nerves rather than just is it muscular or joint, right? So most PTs do this inherently. I think my framework is just how I think about it, and maybe it will bring knowledge, some benefit to people to understand how the body works. So when I look at the back, let's take the back, right? What layers do you have to understand what's happening? The first layer of the back are your bones. So in your back, you have your vertebrae. In between your vertebrae, you have your disc. And you also have your spinal cord like right next to it, right? But the first aspect is, are the joints and the bones, the vertebrae, moving okay? Is that a main culprit of what's happening? Now, specifics of how they move, we don't have to get into that, but there are micro movements of the vertebrae that allow us to move fluidly, like how we bend, how we extend, how we rotate. You need a certain amount of range of motion and mobility in the joints to actually have good motion. So that's like your first layer. The next layer would be the neurological system. So you look at, is it the bones? Is it the nerves? This kind of what Alina alluded to before, sciatica, right? When I hear people come in, I have sciatica, I usually tell them, like, listen, that's a broad term that just says you have pain down the leg. So anyone with pain on the leg technically has sciatica. Don't let it put a label on you, because that's not specifically a diagnosis of one thing versus the other. Because if it is the nerves, you have to know, is it a disc bulge where the disc is poking out and hitting on a nerve? And is that disc hitting on it where it's sensory, where I'm getting shooting, tingling? Is that disc hitting on it from the front where it's actually causing weakness? Like, there's so many nuances that you have to know what's going on, right? It could be something else neurological. You can also have like central stenosis where you get pain down both legs. So there's a lot of variables on if it's neurological. And a neurological, you have to do a neurological assessment, which we could talk more about. Then you look at, is it the muscles, right? The next layer is the muscles. Are my muscles moving correctly? Are they firing? Do I have strength? Do I have weakness? Is it coming from that? Like for example, Alina has scoliosis, right? So we already know her joints are a little affected, which affects her muscles, but the joints are affected. So we need, like, you need to work on mobility on one side, and then, I mean, it's a whole nother process of scoliosis. That's a whole other thing for lower back pain, right? And then the last aspect is just, is it neuromuscular? I know it's confusing. You have neurological, neuromuscular, meaning is my body not firing correctly at the right time? And it can just be that the right muscles aren't firing when you need them to, so you have to re-educate them to how to fire. So those are the 4 levels kind of I look at. And I'll do an in-depth evaluation that will sometimes take 45 minutes to an hour if I'm really, really stumped on what it can be, to try to figure it out.
Has there ever been anyone that you're like, I literally do not know what this could be?
Sometimes with lower back pain, the hard thing, and this is the overlying picture, is it can be very psychological. Lower back pain, when you have it for extended period of time, which when it becomes chronic, it can be psychological. So if there's no specific anatomical issues or functional or neurological exam, that does take a factor into it. There has been some people that I've seen that I had to refer out because I was like, hey, this could be, you can have a growth, you can have something like that, because some things can be scary. For example, like if you're doing a neurological exam, which is where like a reflex hammer and some nerve testing, if the reflexes aren't on par where you expect them, you can have something that's affecting your central nervous system, which is not your lower back. And those things are warranted to refer out. So the hardest part, I think, for me, for back pain and for anyone out there is like, and it's tough because every personality is different. Some people are like, I gotta know exactly what's going on. But sometimes what imaging show doesn't necessarily equate to what your injury is either. And that's a big part of it. It's like, can you be progressing and great at exposure, which means like, hey, I'm fearful of squatting because I have lower back pain. Can I take you through a course of therapy and get you to squatting without fear, and coaching you up through that whole process? So it's such a broad thing, lower back pain. It's so crazy. There's schools of thought out there that you don't even need any manual intervention. You just need exercise. So it's very interesting.
Okay. Yeah, I mean, again, so many people, if it's the number one thing that you're treating, or you see it all the time or hear it all the time, then I would imagine that it's impacting a larger part of, like, you're seeing a fraction of the population. So if you take what you're seeing most of and other people are seeing that as well, like, that's the broader population is experiencing that. And that's really crazy because it definitely is super impactful for your day-to-day life. I mean, if you have back pain, it affects everything that you do, how you're bending down, how you're interacting with your family, how you're interacting with your kids, what you're doing socially on the weekends. Like, sometimes your pain is so intense that you don't even want to do anything because you're afraid it's going to take you out of the moment, or you can't even get in the moment because you're in so much pain.
Yeah, there's some crazy statistics on back pain too, like how many people are on pain medication and dealing with pain medication to manage their pain, and like that's scary. Like obviously I'm PT, I'm biased to being off those meds as quickly as possible, but there's a lot of people who can fall down the rabbit hole of addiction because of that, and lower back pain is one of the main causes for that.
Let's talk a little bit more about how to prevent injuries with back pain, or just back pain in general. I think it's going to be a little challenging, or I think it's a little challenging because you typically don't know. I mean, I guess you could just be preventative and proactive in it, but you don't usually know until it's there and you're like, oh no, I need to do something about this. But what are some ways that people can be proactive to avoid back pain if they don't have it already, or if they have had back pain and they don't want to experience that again?
Yeah, good question. I think you break this down into a couple different models, and one that I like to use that's very simple is something that was coined the joint by joint approach, which pretty much means that you have all these big joints in your body, or areas of joints that either are stabilizing joints or mobilizing joints. So some that are stabilizing, you need to do exercises that are stable. The ones that are mobilizing means you need to keep it very mobile. So like from a very, very kind of first principle modality, how do we ensure that we're keeping the joints stable that need to be stable, and the ones mobile that need to be mobile? So looking at the lower back, the lower back itself, the lumbar spine, is a stable joint. We actually need to create stability and strength in that area. So there's specific exercises we can talk about if you want to, but let's start with there. So the lumbar needs to be very stable. We need to implement stability exercises to make sure we keep it healthy.
Let's just get some examples, like 2 to 3 examples.
Sure. So like a very space level example would be a plank, right? You're holding a position for a while where your core is firing and the muscles of the lower back are firing as well, and you're not moving. So you're increasing stability. Another one would actually be a deadlift, and it's a little more advanced, 2 ends of the spectrum, where you're grabbing a weight, turning your core on, and causing stability with a nice neutral spine. So those are 2 basic examples.
Great.
Now, when you look at the lower back, you have to look to the mid-spine, which is called your thoracic, and your hips. When you think of an injury, you think I have to just look at that area. You can't just be in isolation with one area. You have to look at the joints above and the joints below. So the thoracic spine, or the mid-spine, and the hips need to be mobile. The more mobility that are in those joints, the less stress and pressures on your lower back. That's why, for example, when we're sitting so long, your lower back hurts because your hips are tight and your mid-back gets very tight, and all that pressure goes to the lower back. So you can do specific mobility exercises to enhance the mobility there. A simple one would be a hip flexor stretch, which is the front of your hip. I think anyone who has a sedentary lifestyle or sits a lot needs to be incorporating this every single day, because those muscles actually attach to your lower back. We want to keep those open and mobile. And then your mid-spine, if you're slouched over, you're on a computer all day, you need to make sure that is extending, right? Those need to be very mobile. You need to be consistently working on that. So that's like my base level philosophy of like, how do we keep my lower back from getting injured, right? Obviously, there's a lot more too. Like, I think another layer to understand with this is lifting mechanics. I think this is a big factor. If you were to lift and bend from your spine and lift a heavy weight, there's a lot more pressure on your disc and your spine, and that's when you can have an injury. That's when I see a lot of my lower back pain kind of with disc bulges is from lifting something like that. And the key is to make sure you have a neutral spine and you're controlled as you go. So lifting mechanics is a big aspect as well, because lifting doesn't come naturally. Like deadlift doesn't come naturally. You have to teach that. You have to teach your body how to get your hips to fire and make sure you're moving through that motion.
I think it's also important to note that if you're currently experiencing back pain, that maybe you shouldn't hop into these movements. Like, definitely go get an evaluation, definitely see where you're at and see what you can do in the interim to build up. I'm thinking like somebody who has low back pain doing a plank, if they don't have a strong enough core, they could be dumping their hips and
For
then
sure.
experiencing more pain. And you can do it from an incline or you can modify it to get to a plank position. But just keep that in mind. If you are currently experiencing back pain, it doesn't mean that you should be hopping into these exercises.
Totally agree. I think that's a really good point. You know, everyone's different. This is educational, so you guys can try to understand it. But if you're suffering, like, get some help. Iron Health can help you.
I would say so. The joint by joint method. So we're working on stability and mobility and stability. And then, what are some other ways that people can prevent back pain?
From like
Just
a
like,
lifestyle, or what do you mean?
yeah, lifestyle component. I know for me, like when I talk to people, I focus on steps, but I usually focus on steps for weight loss because a lot of people will clock their workouts and maybe eat right and still not see results. And I'm like, well, you're not doing enough non-exercise activity. And that's something that NEAT is, non-exercise activity thermogenesis. So like you want to be moving outside of just working out. For people that are really sedentary, that's probably the same thing, where intentionally doing stretches and intentionally doing movements is huge, but also making sure you're getting steps in so that you're not just at a desk all day. You drive home, or if you're working from home, you do something else that is involved sitting, whether it's like sitting on the couch to watch TV or sitting at the table to eat dinner, making sure that you're intentionally getting steps in regularly to avoid tightening up from certain positions.
Yeah, I think that's a bigger factor there is understanding that having extra weight on can actually affect your back pain as well.
That's true. I was
So,
kind of just getting at like the mobility component of moving in general,
well,
but
I
also
think,
weight loss
yeah,
or
I think weight loss is a big factor. Like for any, 10 pounds of weight, you're putting 40, 50 pounds on your joints. So losing weight can drastically help
I didn't
you.
know that.
Yeah, it's kind of crazy. And then to your point, basic levels of preventing would be to make sure that if you do have a sedentary life or you sit at work, just set a timer on your phone. Like every 30 minutes, I'm going to get up and do 4 or 5 minutes of stretching, like incorporating it into your life so you're not just on the desk the whole time. That's a big factor for that as well.
Yeah, I know a lot of people are getting walking pads these days, which is really cool.
Funny looking.
They're funny looking, but hey, if it's getting the job done where you're not just sitting at a desk all day, you're able to stand and get movement in while working, great. Because I think a lot of people have the mentality like, I can't do that. I can't walk away from my desk. And that's an issue for them to wrap their heads around. Like, this is unachievable for me because I physically don't have the ability to do that. I want to just tailspin really quick because weight being something that could also impact back pain. A lot of people these days are doing the semaglutides and are using that for weight loss. There is definitely a negative impact with that at times where you're seeing research, right, that those type of drugs are impacting people's muscle mass. So if you're using those, you definitely want to be strength training. I think they're like the muscle mass that you lose when you're taking those, you know, type of drugs is huge.
100%.
So that's something you want to keep in mind too.
Nice little side tangent.
Yeah. Anything else that you would recommend for people to be
Yeah,
proactive?
I think one thing that I notice a lot, and I've been doing this over 10 years, like you said, your mattress matters. How you sleep.
Mm,
How you sleep matters drastically. And we all want this like cushy little mattress. It feels like we're on a cloud, but that might not necessarily be the best thing to do because it puts your spine out of alignment. You want to be able. I heard a good thing one time, and I thought I use this advice for my clients. If you are testing a bed, can you lay on your back? And if you are comfortable with your legs crossed, it's too soft. If you're comfortable with your legs just straight out, it's usually a good sign that the bed is firm enough. So it's a quick little fix. It's like something that you can change in your household to make sure you prevent any back issues.
interesting. And I'm sure you look at too, it just made me think about like mattress, shoes, the shoes you choose are important. And also when you're looking at people and evaluating, I'm sure sometimes their back pain is coming from their ankles, their gait, right?
Yeah,
Like certain things
there's
like
so
that.
many variables. When I look at someone with back pain, there's a lot of questions I ask. Like I said before, I look at the 4 levels. If it's not that, is it their hip? Is it their knee? Is it their ankle? Is it their mid-spine? Like there are so many variables, and it's a lot more in depth than you think it is. And then let's say it is someone's back, depending on the specific diagnosis, like some of them are tedious, like you have chronic lower back pain, which is again like a lot of psychological conversations because you've had pain for so long, you don't know yourself without pain, and you're fearful of things. Like I have a guy right now who's very fearful to do things, but majority of the session he's very high level, and I'm like, dude, look what you can do. Like, and I'm just coaching him into this process and telling him he can do it because he had that bout of pain, and he's like, wow, I don't ever want to have that again. But I'm like, look what you can do. It's so powerful. And then I have another client who is a little older. She has spinal stenosis, and her pain goes ups and down in waves. So a part of that process is understanding what can you modify in your everyday life to manage the symptoms, and can PT help you if your symptoms are a 3 out of 10 or 5 out of 10, can we say, okay, you're a 3 out of 10, but for how long? Can we decrease that? And can you self-decrease that? And like just kind of coaching through that process. So it's a lot of different things. And I have other people who have massive disc herniations. Truth be told, if you have a disc herniation, it's not always a death sentence. Like I've seen someone who had a massive disc herniation where he couldn't even put his leg straight on the mat, rehab without surgery. So there's so many variables, and just know it's like, you can get there. Just trust the process.
So actually, that's a great segue into what my next question is, because I know one of my old clients who has been in and out of surgery for probably close to a decade with her back pain. Every surgeon promises that this is going to be the last surgery, that it'll help, and it's chronic, it's lingering. So what would you say are some ways to determine and decide if an individual needs surgery? Obviously, it's their choice and how they relate to what they think surgery will do for them or not do for them. But if someone's like, Dr. Joe, should I get surgery? Like, what's the cases that you would make to get it or not to get it?
Yeah, good question. I think the first thing, and you said it too, if you have back pain and you made up your mind that you want surgery, nothing you could do is going to work. So make up your mind not to have surgery, for real. Or like for me as a PT, I am biased to PT, right? You should go into PT or any healthcare like practitioner who's non-operative, and say, I'm going to give this all I got, or I'm going to try whatever I can prior to surgery. And for the most part, I think that should be the mentality. You should give it all you got, whether it's PT, whether it's some of these other alternative modalities, acupuncture or a PRP or stem cell. Try to exhaust all your avenues before you get your spine open, because it's a pretty big surgery, and there's a lot of things that can happen, and they're just gonna, to your point, your client's just gonna keep chasing pain and offering new things that she can try that may not work. Now she's getting cut open multiple times for no reason. So understand that like you want to go into it knowing that if this is your first bout of back pain, you want to give it all you got before you start to go down the route of getting under the knife. Now, there are times where surgery is absolutely necessary, right? So we'll start there. One big factor is you can have a disc bulge or disc herniation to the point where the disc kind of, they call it sequestration, where it kind of particles break up out of the disc and it affects all your nerves down your leg. That's an immediate surgery aspect. That's something to note. Obviously, you have trauma. That's immediate surgery. If like you're in a car accident or something and you have these massive fractures, immediate surgery. And then I would say for people not in those categories where it's more chronic, the way I measure it is I ask the questions, what have you tried already? If they haven't tried PT or they haven't tried any alternative modalities, I'm saying don't get surgery for 4 months. Like you got to give it a go. That's my criteria. If they have tried that or they're with me for 4 months, like pain's really bad, still going on, I don't know what to do. It's affecting my everyday activities where you say like, hey, I really love to walk with my grandkid and I can't walk with my grandkid and it's been 4 or 5 months. Then we say, okay, we need further diagnostics to understand if you're a surgical candidate, or further diagnostics to understand if you need a cortisone injection or PRP or stem cells. Again, like those other alternative routes. So that's kind of how I would bucket it. Once it gets to the level where you tried some sort of physical activity or PT for, you gotta give it 4 or 5 months with the good PT. Don't just go cookie cutter. You need someone who's giving you a customized approach. And if it hasn't gotten marginally better, then you start asking other questions. right? Always try that route first, because your body has a tendency to try to fix itself. And with the right guidance, you can get there. So those are my big criteria for that.
That's great. I think that's really helpful because I'm sure, we are coming from a place where a lot of people, it's like, what are the options, And if you're not educated and you don't know, and you're going to your doctor because you're living in pain and you want to get back to the things that you love, and that's what's presented to you, if you're not doing your due diligence and you don't know, then, you don't know what you don't know. So that's great. And, yeah, I mean, what else would you say in terms of back pain? Is there anything that we didn't hit on? We talked about, typically what the biggest factors of back pain are, how you diagnose or your framework, and then the ways people can avoid or be proactive in experiencing or not experiencing back pain, and then surgery. Is there anything else you want to add?
Yeah, I think the big thing to add there is the psychological aspect of back pain. For some reason, it's the biggest one of the biggest issues with back pain is like how it affects your brain, because it's so debilitating. So you need to be very hyper aware of that. There's a lot of books out there to read up on it, but you also need to, like, I have a client right now who's very hyper aware of it, and we talk through it, because he's super hyper aware that his brain is doing this to him, and it can send you in a negative loop. So you got to be around a positive environment. You know, you got to demagnify that pain. Like, don't just be locked in on it, because it's going to consume you, and pain is like that. So there is a big aspect of it that's psychological that you need to work through, and it's normal. It's normal to understand that that's a part of it, but don't be so close-minded that like you're never going to get better. Like, you need to have an open mind that's going to help evolve you. So I think that's a massive thing with lower back pain, is being aligned with a right practitioner who will help guide you through the barriers of your own mind, because it's huge. It's a huge component of anyone with lower back pain.
Yeah, I believe that tremendously, because we talked about, how surgeries impact you in the post-op. So if you have chronic back pain, I mean, for sure, you're going to be living in a state of, is anything that I do going to hurt me, and for how long? And, I don't want to be in that pain and being so afraid of it. Question just came to my mind. I don't know if you know the answer. Do you know if people do end up getting surgery, how many people, if there's 100 people that get back surgery for whatever back pain they're experiencing or whatever back injury they're experiencing, out of those 100 people, how many people actually feel better post-op?
I don't know off the top of my head.
Okay.
I think it's, from my experience, what I've seen, it's probably like, if it's warranted a surgery, you got a 50-50 shot,
Okay. So 50%.
from my experience.
Yeah. And then, of course, there are people that get the surgery and feel it worse or the same. So it's almost like you're going through all of these steps and you're not.
Yeah, that's why, why not exhaust everything in your disposal to try to see if anything is going to help you, and like, just never give up in the process. Like, just keep trying different things until it's really affecting. You can't walk, you can't get up from the bed. That's when you start asking those questions. Mm-hmm. To me, I'm a PT, right? So I'm going to say that.
Awesome. Thanks for all of that information. And I definitely actually learned some stuff today. So that's pretty cool.
Oh, I taught you?
Yeah.
Wow. Yeah. Let's mark that in the calendar. She learned from me today. Because that's the only thing I'll get. It's the only shit I'll get.
No.
All right. So if you guys like that, let us know. It's back pain is a monster. Everyone is going to be different. So this is just general information. Take it with a grain of salt. And thank you guys for watching. And if you want more information, powered by Iron Health, you can email us directly, and we'd love to help you out.